Today we're going to talk about the body. Last time we've connected the neuromusculoskeletal system. Today we're going to have an entire look of our body. If we really strip down naked, we see only our skin. We don't really see anything inside. So let's go into the deepest part. What controls our body is the spinal nervous system, right? The nervous system. The nervous system starts from the brain to the central core, which spans all the way to our fingertips and our toes. Once you think about this, wiggle your toes, wiggle a little bit, and think about, you just heard me said wiggle your toes. Through the ear, you send a signal all the way down to your toes and you wiggled it. That is the longest connection from your brain to the toes. Often, I want you to think about it. Try to do that often. Then we have the spine that covers the central core, which is most important for our movement of our body, turning, twisting, bending. And each vertebra, we have 7 cervical, 12 thoracic, and 5 lumbar. Then we have the legs. The legs that consist of the pelvic bone, that holds our upper body weight, and then we have the long bone of the legs that gives us height. And then we have the rib cage. Rib cage, we have 7 pairs of actual rib cage that connects to the sternum, and then we have 3 that goes to the chondrocostal cartilages, and then we have 2 floating pair of rib that protects the kidney. And then we have the shoulder blade and the arm, which give us the extension for us to reach. And then we have the skull, which covers the entire head, solid, with no ability for anything to puncture through, because our brain cannot take any damage, puncture, that could cause any dysfunction to the nervous system. Then we have our muscle. Muscle gives us the ability to move. Without muscle, these bones can't move at all. So muscle is actually also very important from left to right, front to back, and side to side. And then we cover it again with skin. And from there, we don't really see our body. We don't really think about it. And we often forget about it. We forget what's inside. We forget that our muscle and bone needs to work together, and we need not to favor one side. Okay, so let's go back to the basics of the spine. Our spine has a curve. This curve is there to absorb shock, to receive the ability for you to not have any damage if your curve flexibility is there. Now, without this curve, as we get older, we get a little stiff and we get a little bit rigid. And if we fall, we could have fracture that could happen. Of course, not as bad as the picture that's showing right now. But that's how we degenerate with no flexibility and how injury occurs. How does this curve start? Well, first of all, when we're in our mother's womb, we don't have any curve at all. We're super flexible, C-shape, okay, all curled up. And as we are born, we learn to look and lift our head. Did you know it takes 6 months before we could really lift that really, really heavy head? After you lift your head, you really don't pay attention to see where or how you position your head anymore. After that, we start to crawl. Now, spinal development is really important during crawling stage. It helps develop the peripheral nerves in our body. If a child skips crawling, oftentimes it could contribute to balance problems or coordination problems as they grow up. In about a year or so, we start to stand and walk. And then after our curve develops according to our need. Oftentimes people ask, how does spinal injury occur? Well, it occurs as early as when you're being born. The first spinal misalignment is when your head needs to be pulled out, your shoulders too wide, it needs to be turned to pull you out of the womb. And that often could cause little misalignments that we're not aware of. As studies have shown that we would have fallen 300 to 500 times. And of course, there are some other possibilities, such as handling of our parents being super excited, taking us for a ride, fun, all sorts of things, our own happiness of jumping, running, and falling unintentionally, all that could be a cause to a progression of a curve, which when you're young, it's a small curve. As you get older, it becomes a bigger curve, which we label it scoliosis. Now, as for girls, usually the growth of height stops when period shows up. So it could be as early as between 10 to 13-year-old. As for boys, it could be a much longer process where they can grow all the way till 19 or 21. It is important for girls to be checked earlier for scoliosis versus boys. It's to your advantage to get your kids checked around 7 or 8 for girls and around 9 or 10 for boys, to screen for possibility of any curve development. Now let's look at the disc anatomy. Healthy disc allows transfers of fluid in and out. That means nutrients in, nutrients out. It's like a sponge that absorbs and expels waste. Okay? This disc is really tough, where outside is a very tough aneurysm fiber. Inside, there's a disc moving around. Sometimes we may have minor injuries that might tear the aneurysm fiber a little bit. That would cause to have lost its ligament toughness. When we get injured, there's possibility that we may have a looser joint or a tighter joint. Now let's look at the anatomy of this disc. With this disc in the front, behind the disc is the nervous system, as you can see. Each segment has 2 pair of nerve coming out to the left and the right. Now let's go back to the level of each nerve function to where it supplies. Cervical area tend to be mostly for the upper body. Okay. Lumbar area tend to be most of our lower body. Each of these level has nerve to the different organs and muscles to that level. So essentially, if anything happens, such as a disc herniation or disc protrusion, it pinch on one side or both sides, or more central-lateral, meaning a little bit to the middle, a little bit to the side. Now, when this protrusion happens, it didn't happen over one day, unless you had a car accident or some sort of a large impact to your body, such as a direct fall from a bicycle incident or a car hit, or anything of a sort of you landing on something hard. When the disc is protruded, you may or may not feel major injuries or feelings. It could be just soreness that comes and go, and if you rub your back and change your posture and do some stretch or heat pad to the area, it loosens up the tension a little bit and you feel good. But one day you may have another impact or injury or slip and fall. That could cause you to have a rupture, which is going to cause the sensation to be more constant, such as tingling numbness that is almost all the time. If you have symptoms that comes and go and it's just mild or controllable with some sort of self-care, that means you have something repeatable and gradual that you may need to start putting some effort into finding out what exactly the problem is. Now let's look at this disc anatomy. This picture shows that if you stand straight, your disc, there's a probe on your lumbar disc that shows the pressure is 100 if your ear shoulder all lines up. As you lean, as you sit properly, same thing. You also have the pressure being 100, but as you lean forward, that doubles because your upper body weight, shoulder weight that leans forward, which contributes to doubling that pressure weight. Now, often we bend over to lift something or wash dishes. Look at this. When you're bent over, not even touching the box, your weight of the disc already increased up to 600 to 700 by the time you pick up that box and lift it up. That increased quite a bit. Now, if you were to preserve your lumbar disc, that arch is preserved as you squat down and up, look at the weight, it's still at 100 until you pick up that box, it goes up to 350. Okay? Now, when you have pain, you're allowed to lay down. Whether it's laying down or on your back or face down, it's the least when you're face down with your tummy down because there's nothing on top of the lumbar and the curve is being preserved. Now, that doesn't mean that you can sleep on your stomach. This is only when you're in pain what to do. You could put an ice pack on your back and lay it on your tummy. Oftentimes when people have lumbar issues, they would get some sort of traction device done to help them release, which is good. It could be done whether they're laying or facing down on the table where the machine moves. Now, if we go back to the disc anatomy, by doing so, these discs gets temporary release, but if you really think about it, if you don't change anything with your daily posture, the disc is still being pressured and the bone spurs are still forming and all that impingement, it's still there. Now, if you don't do anything and let it degenerate, through time, bone spurs forms and the disc will thin out and the disc will thin out and the nerve in that area will be pinched where the function may be less, and that's what we call nerve atrophy. Now, we're at the earlier stages, and by going through therapy, going through some sort of traction, using some sort of device to help yourself, you may be able to recover the earlier phase of your disc compression. If you're at the later stage of your disc compression, there may not be too much to do to restore back to normal, but you can prevent yourself from getting worse. And that is the key to why everyday mindfulness of your posture and daily stretching and usage of some sort of device to help you throughout your life if you know that you have disc problem is very important. Often people think that no feeling means no problem, but that is not true. If you look at your lumbar region, there's really nothing there except the lumbar spinal vertebrae. If you do not contract those muscles, your joint is taking the entire body weight. If you look at this through time, the lumbar curve and cervical curve is supposed to curve forward. But with injury, there may be what we call stuck, lack of range of motion, a restriction. When that occurs, all your range of motion of turning, twisting may be limited, and through time it gets what we call fixated or stuck or pulled into a common position where you're not aware. As we look at our cervical curve, this headway is quite heavy. When you don't think about it, because after 6 months of trying to lift our head, after that, we don't realize how heavy it is. We use it like normal. And our posture forms through habit. It becomes a normal thing if you're not aware. You could have a hunchback, a round shoulder, or a head tilt without knowing because you never check your workstation or shift your mouse usage or washing dishes, cooking. All this contributes to a prolonged usage of muscle uneven tension and also lack of stretching with muscle usage, overusage. It would cause spastic reactions where you may have pain, and then we compensate it by tilting our body to the opposite side or trying to shift our weight. Now, if you have an injury, you may be walking with a pain on one side and you shift your entire weight to compensate to the other side. Through time during recovery, you might have forgotten that you need to train yourself back to normal. So these are all the possibilities. Once again, It is all about checking yourself, be mindful of your posture, and we go back to my reminders that each and every day as we brush our teeth, we should think about we need to stretch our muscles. We have 650 plus muscles in our body, 205 bones. And do you really check to see if their flexibility is there? How often do you strengthen your muscle to make sure that it's good enough to support your weight usage throughout the day? How often do you get your spinal check to make sure that each one of these vertebrae are moving so that no fixation occurs for the possibility of degeneration? It is important that you try to keep these in mind. And now we're going to open up for questions.